Hello and welcome to accessing and effectively utilizing state and local agencies for outreach and support to job seekers with disabilities. This is our celebration. This is our panel. We are joined by some outstanding members of the disability rights community, and I'm so excited to hear from these panelists, who will be introduced to you one by one. I am Cheryl Sharp. I am the Deputy Director and Commission Attorney at the State of Connecticut Commission on Human Rights and Opportunities, the oldest governmental civil rights agency in the nation. And I am honored to be here with you today to celebrate 30 years of the Americans with Disabilities Act. Our first panelist or speaker, if you will be Joe Wendover. Joe, can you unmute your mic and give us an introduction? Tell us a little bit about yourself and your organization.
Absolutely. So hi, Cheryl. Thank you. My name is Joe Wendover. I'm formerly the Chief Human Resource and Diversity Officer for Company Viability, and now I am in the private sector for consulting, where I help other organizations employ more people with disabilities. I've been in this field for well over 15 years. I started the Walgreens program that when we implemented it was to hire a third of their workforce people with disabilities. I did all the accommodations for the Walgreens supply chain at the helm of Randy Lewis, who was our beacon, and he's been fantastic and he's still a great mentor. But it's something that I love to do, and it's something, like I said, I've done for most of my career, and I'm very passionate about it. And I think that everybody has the right to be passionate about what they do and get paid to do it. So whatever your ability or disability status is, I think that everyone has that right.
It would help if I unmute myself. Thank you so much. And next we have Janet Fiore. If you would unmute yourself and introduce yourself, that would be wonderful.
Thank you so much. I'm Janet Fiore, and I'm the CEO and founder of the Sierra Group. We've been around since 1992. When I was a very young girl, I like to say, but seriously, back in 1992, the Americans with Disabilities Act was 2 years old, and the Rehabilitation Act of 1972 had been amended to serve those with the most severe disabilities first. That is what impassioned and empowered me to start a female-owned business as a person with a disability to focus on assistive technology in ways to help people with the most severe disabilities get services through the Commonwealth of Pennsylvania's Voc Rehab system, where we became their very first AT vendor. We've gone on to do assistive technology services regionally as well as nationally, and quickly that making the AT work for the person in the workforce led to lots of large corporations across the country bringing us in to teach them and work through the digital access components of making that device work on that network. We've been in the digital accessibility field long before it had a buzzword and a term that's known. One of the very first people I ever employed was an individual named Elliot. Elliot came to us as one of our very first referrals from the state agency to get ready to go to the workforce. He'd fallen down a set of stairs and was C2 quadriplegic. Working with Elliot back in the early 90s to get him portable technology with voice recognition so he could go to school to be a programmer. Let me tell you, that was not a simple first out of the box task, but it helped us realize if you love technology and you work with people and you help them maximize their strengths, the rest is completely up to the business to open the doors and bring them in. Elliot went on to get a job with Roman Haas, now part of Dow Chemical. And when he was done working there, he hit me up to become our accessible web designer. It was with Elliot's insistence that we started online disability recruiter certification programs. We started a recruit disability job board. And on his dying days, he said to me, if you give up the charge for digital accessibility and accommodation, you will not sleep well at night. Because Elliot, in addition to being a fabulous person, was the funniest, most sarcastic employee I've ever had. And recently, because leading that digital accessibility without his incredible skill set was leaving me a little bit in the lurch, even though my other team are expert at AT and accommodation, I recently partnered with Mike Mangos, CEO of Tammin. We now have the Sierra Tammin 360 collaborative to train, educate, and remediate any digital accessibility or accommodation issues. We still work closely in the state VR system, helping people get ready to go to work. And it's that day-to-day connection between helping people get skills for work and helping businesses bring them in that keeps the passion alive for me. Thank you.
Wonderful. Thank you so much. And next we have on our panel, Andrea Askie-Rosario.
Hello, and thank you once again. My name is Andrea Askie-Rosario, and I work for New Jersey Commission for the Blind and Visually Impaired as their business relations specialist. I've been with the agency for about 4 years in this role. Before coming to New Jersey Commission for the Blind, I worked in Philadelphia with the Office of Vocational Rehabilitation. Most people call it OVR. I was there for about 6-7 years as a voc rehab counselor. Working with people with disabilities is something that I hold dear to my heart and that I'm very passionate about, since I am someone that has a disability. I am currently diagnosed with a visual impairment called Stargardt's. Stargardt's is a retinal condition that deteriorates an individual's central vision. It's considered the juvenile version of macular
Degeneration?
Macular degeneration. It's like a tongue twister. I was diagnosed with this condition after I graduated from college. I remember driving home from work one day when I realized that I was having difficulty driving home. Seeing at nighttime, I was struggling. Then just as time went by, I just felt my vision deteriorating. And at this point, it's somewhat stable. But having a disability has given me a true understanding of what individuals with disabilities go through in the workplace and on the job, and at home. And so that's why I love what I do when I'm working for New Jersey Commission for the Blind. We are a state agency. We were established in 1910. This year, we're celebrating our 110-year anniversary. And our agency was established by local state legislators to make sure that individuals who were visually impaired were provided services in the areas of education, employment, independence, and eye health. When you hear the words blindness and visual impairment, those are the individuals that we serve. Most people think of an individual who's totally blind, an individual who sees shapes and shadows and a little bit of color. Many people are not aware that blindness comes in all types of forms. The individuals that we serve at New Jersey Commission for the Blind come to us from all backgrounds, all race, ethnicity, and with different vision loss. For instance, we work with individuals who have similar eye conditions such as I, where they have central vision loss, individuals who have a deficit in their peripheral vision, individuals who may see things, who may have restricted vision where they may see spots of vision here and there in the vision. Then we have other individuals who only see things during the day and their night vision is poor. With our agency, we work with everybody. We work with individuals from childhood to adulthood. For instance, a parent can come to our agency that has a 5-year-old child and say, how can you help me assist my child to go to school? Our agency, we have professionals called the Teachers of the Visually Impaired, and we have them in every county throughout the state and in every school district. And their job is to make sure that each child with a visual impairment has equal opportunity and is able to equally participate with their peers. So if a child is unable to read the printed materials, that teacher of visually impaired will make sure that there's an alternative format for that child so they can participate. So they might provide the information in large print. They might provide the information in Braille. They might provide it in audio format. Their job is just to make sure that that individual child has a level and equal playing field. We also work with adults ranging from college students to older adults. When it comes to adults, we make sure that if an individual would like education or employment, we provide them with that. So if an individual comes to us and they just have experienced some type of accident where in their past profession, they were a professional driver, and because of the accident, they're no longer able to perform that task anymore, and they're interested in going to be a social worker, we would connect them with a vocational rehabilitation counselor, which would basically take them by the hand, develop a vocational plan with them, and help that individual get the education that they need in order to be successful in that field. Once they have the degree or the certificate that they need, that vocational counselor will help them prepare for work and find employment.
All right, thank you so much. Thank you so much for that wonderful introduction of yourself and your organization. Our next panelist is Bonnie Rivers.
Hey everybody. Hi, thanks Cheryl. It's a pleasure to be here today, joining my esteemed colleagues, I'll call us, on this panel. My name is Bonnie Rivers. I'm the Director of Employer Relations for an organization called Work Without Limits. Work Without Limits is actually an initiative out of Commonwealth Medicine, which is the consulting arm of UMass Medical School. Did I lose anybody yet? So part of UMass Medical School makes us, in fact, a state agency in Massachusetts. So we're a mission-driven organization. And really what we are is a network of employers, educational institutions, employment service providers, state and other federal agencies, and individuals with disabilities and their family members. And together we collaborate and we partner, all behind the goal to increase the employment rate for people with disabilities. So all of our programs and services are geared to meet all of those constituent needs. So businesses that actively recruit people with disabilities as employees, but also within their supply chains, individuals with disabilities who are seeking jobs, and all of the employment service providers that serve them. So how do we do that? Well, we do it in a lot of different ways. One of the major ways in which we do that is through a B2B network, or a business to business network, where organizations and corporations sponsor us financially to participate in this network and help sustain our mission. Right now, we have close to 45 organizations, small names like MIT and Boston University and Harvard Pilgrim Healthcare and CVS Health, and lots of big names. And I'm going to get in trouble because I'm leaving out, 40 of them. But lots of big names that many of you may be employees at these organizations, or hopefully you frequent them. So these organizations get together. We have roughly about monthly webinars. Together, we are called Disability in Massachusetts, as we serve as the Massachusetts affiliate of the national organization called Disability In, which nationally focuses on businesses improving their inclusion capacity around people with disabilities. So that's our business to business network. Do a lot of work with them, which kind of transfers over to the training and consulting work that we provide. Many organizations come to us and say, we want to hire people with disabilities. What kind of candidates do you have? And that's a loaded question because number one, we actually don't have candidates, although we do partner with over 75 employment service providers across the state of Massachusetts, both state agencies and also smaller nonprofits. And we actually utilize those partnerships because they are closest to their own candidates and their own constituents. So what we do is we match these community partners with our employer sponsors and all those businesses that are in that business to business network called Disability in Massachusetts. So we're, in effect, we're kind of like a glue that brings the candidates and the employment service providers together with our sponsoring employers. We do a significant amount of training and consulting, both for the businesses, part of our network, but also any business that wants to contract with us, as well as all of those service providers. So some trainings that we might deliver for businesses, two of the most popular are disability etiquette, and the other is disability awareness and the value proposition that people with disabilities bring to organizations. We also get into, how the unique aspects of interviewing candidates with disabilities, supporting employees with mental health challenges. And then on the other side, as far as employment service providers, we're doing lots of training around the nuts and bolts of SSI and SSDI. We train around Social Security work incentives, really covering all sides of the coin, making sure candidates and their family members, job seekers with disabilities and their family members understand the impact work will have on their business. And we have benefits counselors, on their benefits. And we have benefits counselors that help them navigate that process of working off benefits and getting to work. We also offer consulting services for those organizations that are coming to us in a whisper saying, we know we should be doing something around disability inclusion, but we just don't know where to start. And actually, that's kind of my favorite because you see such quick paced, fast growth with organizations like that. So we do a lot of training and consulting. We also have 4 signature events each year. We host 2 career fairs. One in the winter is specifically for individuals with disabilities who have college degrees or recent college graduates. And then the one in the fall is for any individual with a disability, regardless of educational or experiential background. We also host a disability mentoring day. I shouldn't say we host it, we coordinate that with many of our member companies that want to participate. Which is always a huge hit. And we did that. We designed Disability Mentoring Day thinking with the goal that this was going to be a tremendous benefit for individuals with disabilities who may never have seen a corporate environment, for example, or known what it's like to get up, get dressed professionally, maneuver their way to work, attend work, come home, which all of that happened. But additionally, what happened was employers had their jaws on the ground and they said, this was just the absolute best thing that we have participated in because we've learned through exposure how much individuals with disabilities can do that we had made assumptions that couldn't be done. So Disability Mentoring Day is always a tremendous effort. And then our final signature event that we host every year is an annual conference. This year is our 8th annual conference, first virtual. And I know we're going to talk about some of the challenges and the silver linings that happened with COVID. But it was our first virtual conference each year where we have a great keynote speaker. This year was Mario Arnaz Bonds, if anyone is familiar with the GLEE project. Last year, we actually had Travis Roy, and our heart goes out to the Travis Roy and his family and the foundation as he recently passed. So our annual conference consists of lots of breakout sessions, keynote speakers, networking time, and it's a great time for people to connect and build out their network and learn about disability inclusion. We offer benefits counseling directly to individuals with disabilities and their family members. All of our benefits counselors are highly certified and trained. It's a job I could never do. These are very smart people who know how to navigate the Social Security system. And we also offer loads of resources on our website, workwithoutlimits.org. All of those resources are available to the public, where again, we're pointing you in different directions based on what your different needs might be. So the resources we list out there are we've vetted them. So, you need questions about accommodations, we're pointing you to the Job Accommodation Network. So we're not the experts in everything, but we pride ourselves in being a specialized generalist, if that's the best way to capture it, where we can point you in the right direction based on what you need. Finally, one thing that we offer is called our Higher Thinking initiatives. And this is our kind of innovative think tank, if you will, where organizations, including other state agencies, come to us and say, we're working on a project. Would you participate in this project with us? And many times that project, what they're seeking is exposure to corporate America and the business world and what the perspective is of businesses around disability inclusion. Because of our robust business network, it's a phenomenal win-win partnership because organizations want the business perspective and the business wants to learn from all of these employment service providers as well. So we connect the businesses with the service providers. We move the state of Massachusetts forward in its disability inclusion initiatives. So we've got a lot going on, a lot of different constituents. Some of our services are, sponsorship only type of things like membership in our business network, but things like our training and consulting is available to anybody, and certainly our website as well. So thanks for having me here today.
Thank you so much, Bonnie. And our last panelist, but not least, is my colleague, Michelle Dumas Keuler, who's an attorney with the CHRO. And Michelle, if you could do your introduction, and then we're going to move on to the question round.
Sure. Hi, everybody. My name is Michelle Dumas Keuler, and I work with Cheryl at the State of Connecticut Commission on Human Rights and Opportunities. As Cheryl has already said, we are the oldest state-based civil rights organization in the country. Our job is to enforce the civil rights statutes in Connecticut. We have similar partners throughout New England. The Mass Commission Against Discrimination is in Massachusetts, and Vermont and Maine and Rhode Island, but we're all very similar agencies to us. And I kind of feel like in some ways, we're kind of maybe the place you come when maybe things haven't gone so right, because we are the agency that enforces the statutes, and we do that through complaint processing, investigation, and prosecution of allegations of discrimination. And disability, both on our housing and our employment side, is the #1 protected class of complaints that we receive at the Commission, and that's so nationally. There are a lot of people who are working with disabilities and working longer and maybe developing a disability that they didn't necessarily have earlier in their career. So we are the entity for that. But that being said, we also do a lot of education and outreach. And so we do a lot of training with companies, with housing providers, in order to give them the information they need about accommodation and what it means to work with a person who has a disability, and to give them a reasonable accommodation based on their need so that they can perform the essential functions of the job. And that's as important as unfortunately going into a court and suing people. No one wants that. So we would much rather educate and train in order for companies to do the right thing, because a lot of the time it's not that they're intending to do the wrong thing. They just don't know what the laws are and what the requirements are. And so we need to help them along with that. And that's what we're here to do. Our services are for free. to the people who file complaints, to the people we train. We go all over. We go all over on Teams and Zoom now, but we really are all over trying to help people navigate this. And when we move into the question portion of this, it's really, really been significant in terms of the changes to disability because of COVID. And so it's something that is really important that we talk about, because as I was thinking about this, I don't have a lot of answers, unfortunately. Everything is so new, but we want to help get to those answers. And maybe that means getting through some of these cases to see where we're going to land at the end. So I look forward to the question part. Thank you.
Thank you all so much. And we are excited to hear from our panelists. And I have a list of questions for our panelists. These are unprecedented times, no doubt. But let's talk about 30 years of progress and 30 years of inclusion, even though we are in unprecedented times. And to set up the stage for our discussion in this question and answer portion of our panel, I want to say to the panelists, because I have so many questions for you and there's so much information to get out there, when I ask you the question, you're going to have about 60 seconds to respond to the question. And so I'm going to really be testing to see how quickly you can put all of your years of experience and wealth of information into sound bites, so that we can help our viewers along in terms of them getting the most information that they can from each of you, since we have 5 of you. So let's not hear me talk anymore. Let me ask my first question, which is, how has the pandemic and the really fast pivot to remote working impacted your mission or your messaging of your organization or agency? So let's go back to Joe. Joe's using up some of his time unmuting himself.
I figured I would just pause a little bit, wait, 60 seconds. Sorry, I had to find the unmute button. So the thing about the pandemic and everything that's going on with working remotely and that quick pivot that we had to make, honestly, with messaging, to me, it makes it even easier when you're hiring people with disabilities, right? For some, there's a lot of folks that working remotely is an option. And, I talked about it a little bit before, but a lot of organizations in the past, we've thought of opportunities where people wanted to work remote and we said no, because it wasn't common. It was we've never done that before. Why would we do it now? And I think now in the last 8 months, what we've seen is there's so many opportunities out there that people can work remotely, and it makes it a lot easier. Or, and when you think about diversifying your workforce, also there's positions that now maybe were once based in a rural, town in Texas, but now you can get that diversity and open up a little bit more if you're looking at remote employees. So I think as many bad things have happened in 2020 and the pandemic has brought to us, that's a silver lining. There's a little good there that it has brought to us.
Thank you for that response. And let's shake things up a little bit and go to Andrea. Same question.
I agree with Joe. It has brought a lot of new opportunities for individuals who need to work, basically. A number of the individuals that we work with at the commission, they rely heavily on transportation. And so since we have remote work now, it's provided opportunities. We won't have individuals spending most of their money, traveling Uber and Lyft trying to get to work versus them just working from home. So yes, it has opened up new possibilities and new opportunities.
Great. It sounds like that there may be even more of an opportunity for more productivity because there's not that traveling time. Yes. Maybe people will feel somewhat inspired. What say you, Bonnie?
COVID definitely has had its silver lining. It's an odd sentence to even say, right? Because it's completely tragic in its effect. But a few things have happened for us. We deliver, as I mentioned, a great deal of training, and that training, some of it we had online very quickly. All of it we now have online. So for us, from a business model standpoint, significantly helped us. I went from delivering many, 30 person in-person training classes to now a webinar for 100. So I feel like our reach is larger. Our fall career fair doubled in size because it was virtual. We had over 200 candidates with disabilities online. In our business to business network, last year, mental health pre-COVID was a big discussion in the workforce. With COVID, it is the discussion in the workforce. Additionally, with Black Lives Matter, intersectionality has become an enormous, awesome conversation to have with businesses, and has elevated the conversation around disability, as well as women and Black Lives Matter and et cetera, LGBT community. So it's really done a lot for, I think, opening worlds, including the ability to work from home, which was, stigmatized a bit by some before.
Right. And what do you think, Janet?
Thank you. People with disabilities definitely are wired for adaptability. So when you look at the statistics of how well folks with disabilities transition and take on challenges, that's been a message to lead with. But accommodations themselves, which is what we really focus on for our large corporate customers, we've hit a lot of challenges. And kind of back to my opening and my commitment to people with disabilities that rely on adaptive technology, digital accessibility is an obstacle. It's not the opportunity. Working from home is absolutely doable, but for example, an employee who's visually impaired isn't really sure what everybody's doing on the Zoom call if you don't remember to audio describe it. It has caused the need for our etiquette and awareness training to focus on, are you digitally accessible? Are you sure your job application and your recruitment process is taking into account the specific needs of people with disabilities? And let's not forget the societal need to overcome the digital divide. Many folks with disabilities live in poverty. They don't have access to the internet or a computer. That's become the mission of our foundation, to work with our corporate partners and make sure we are giving away computers and internet access to overcome that digital divide. It's been a big change.
Thank you. And Michelle, can you add to this conversation?
Sure. I mean, I think at the commission, a few things happened. We really tried to provide a lot of in-person service to people. And so we would have people come into our agency all the time in order to, all of what we did was a lot of in-person, as the legal system tends to operate that way. And so we very quickly moved to remote. For intake, for mediation, for everything that we did. And in the end, it really did make it so much more accessible to people who may have had challenges coming to our regional offices, or who just had a comfort that was different in their home environment than coming into our building. And so we did that really fast, and we really have processed probably more complaints by switching to really virtual in terms of all the intake that we do and all the processes that we engage in. The other thing that we did really fast, and Cheryl and I talked about really fast, was because Cheryl and I and a few of my colleagues are out in the field a lot, that just stopped. No one was anywhere, but the need was so great for information and for knowledge about this really scary time period. And you wanted to kind of be the light to know that people knew that you were still out there, and that if they needed help, we were really going to help them, because we were all here waiting to be asked to help. So we started a series of webinars that we provided about the agency and how we were functioning, changes to the laws, a lot of filing periods were extended, all kinds of things that people wouldn't necessarily know. We weren't waiting for them to come and ask. We put all the information on our website. We created new sections on our website in order for people to have specific information related to COVID. And then, like I said, we have continued in partnership with the EEOC and HUD to provide a series of webinars, topic specific about disability, education, equity and equality that has risen as prominently as this pandemic, in terms of importance, though it was always there, the light was shed bright on it this year. And so we really changed how we deliver our services in order to make sure that they were accessible in a world where you can't really see people anymore safely.
And Michelle, staying with you, what has been the largest hurdle, do you think, for the CHRO? Bonnie talked about there's a larger reach, so that's certainly a positive thing, a positive outcome. But what has been the greatest hurdle?
I think a few things. I think obviously the technology has absolutely been one of the hurdles. I think we were just switching. We had just been given this new Microsoft Teams platform to use like the week before everything happened. And so we were, as an agency, not overly familiar with it. And then we needed to really shift fast into using this technology. We didn't have enough computers. We didn't have, that was no fault of the management. It just, we are not equipped as state agencies across the board to work from home. We're not. And we had to be equipped to do that, from even just getting a virtual private network access, VPN access. There was something like 800 tokens to do that. And now there's like 800,000 for the state employees to use, some ridiculous number like that. So technology, I think, has been the most difficult for sure, because not only is there an access issue, but there is a comfort issue with it also. And so even if we have the technology up and running, I will still encounter situations where people are not comfortable with it. And you just really have to be super flexible to make sure that you're providing access based on what people have and what they're comfortable with.
Thanks, Michelle. And Bonnie, you talked about that you can reach more people, which I think is wonderful. That you were doing, in-person trainings with 30 people, and now you could reach, hundreds of people in a clip, and that's so great. But what are the hurdles, or what is the largest hurdle that you think that you've had?
The largest hurdle that we've experienced is disability is personal. Right. So you're taking something very personal and you're making it very technical with all of this technology. So it's really tough sometimes we miss that. That's the biggest hurdle. I mean, our organization, we're very friendly, personal, like our annual conference. It's all about let's go have coffee and let's connect. And so trying to find ways to do that when everyone has Zoom fatigue, Teams fatigue, whatever you want to call it. I mean, the last thing you want to do is open up that laptop at night to do like a networking session, and everyone's trying to get really creative. So I don't think it's a unique challenge, but for us, that's been quite a hurdle, is trying to overcome, trying to maintain the personal connections, and our benefits counselors who work directly one-on-one with individuals who used to see people personally are doing a phenomenal job with doing it technologically.
Great, thanks. And what about you, Joe?
Yeah, so it's actually a combination, right, of what Michelle said about accessibility. I think we took for granted, at least I have. I felt like everyone had a computer. Everyone knew how to use a computer, and it's not true, right? We were learning that when we're saying, "Hey, go remote," and people are like, "I have a flip phone. I don't even have Wi-Fi at home." So that's a aha moment for us, right? To say, okay, we do have an accessibility issue. And the other part, one of the biggest challenges is engagement, right? I think kind of what Bonnie was saying, that, when you're working for an organization, the engagement is really easy when you have that human touch and you can talk to people and go grab coffee and go to happy hours. But the engagement is really hard when you're doing it remotely, because the last thing people want to do is get on another Zoom or another office meeting. So one thing that we did is I did a virtual 5K that really went well. And it was more successful than our live 5Ks, in the sense that we told everybody you have to run, bike, or wheel a 5K. And you could do it anywhere you want. You need to do it on these 2 days, and you just have to record it, and that's it. We had 150 people participate in a virtual 5K. The year before, when it was in person, we had 5. So that's a huge difference, right? And so when you talk about little things like for engagement, I think we have to remember that there was a world before the pandemic, and there's going to be a world after. So we just got to figure out where it is and where we're going and how to make the best of it sometimes.
Great, thank you. And I think engagement is important. And so, and difficult now because there is some fatigue. But we try to make these Zoom meetings exciting and give really good information and keep people interested. And I think that's important. Andrea, can you add to this discussion about the hurdles that you've had to overcome with this pandemic?
With our agency, because we serve individuals, who are blind and visually impaired, we have, I guess, three core services that we provide. Our adjustment to blindness services, and we usually provide those services before an individual goes to school or goes back to work, just so they can be able to function and do things as regular people in society. And so, for instance, at the beginning of the pandemic, we had a couple of people who were offered job opportunities, and they had to turn the opportunities down or prolong their start date because they didn't know how to travel safely to these particular positions. And with our transportation, our mobility instructors usually go out in the beginning when they first meet an individual and make sure that the individual knows how to travel safely to and from work. And then another one of our adjustment to blindness services is our assistive technology training. And so usually our assistive technology person would go out to the job site, do an evaluation at the work site, but because of the pandemic, our instructors weren't able to do so. I mean, we've been trying to do it remotely, but it's not the same as going on site and evaluating and giving that in-person training.
Thank you so much. And Janet, what are the hurdles for you?
Thank you. I'd like to piggyback a bit off what Andrea said regarding services and individuals with disabilities. So many people with disabilities that rely on the public programs of vocational rehab really, really wish they had Zoom fatigue. They wish they had the opportunity to have the technology itself or the access to be able to be part of this remote world. We've got to be so careful that we don't let just hundreds of people daily drop out of touch and drop off. When we took our school overnight remote because our corporate online training programs had enough capacity in the platform to immediately adopt our nonprofit school. So literally overnight, we worked late and we had it available. But then we had to go into old-fashioned mode. We were FedExing out correspondence coursework and calling people on the phone to teach them so that our learners that were at home that couldn't be keeping up with classwork didn't feel like they were left out of society. We were getting food and supplies delivered via Amazon because people didn't have accounts set up. There's so much shifting of pandemic related, like it really brought up the haves and the have-nots. On the corporate side, sales are through the roof. Our online training programs are so popular now, and companies call, and the Zoom training, it's phenomenal. Like we could actually reach the point maybe when more businesses are trying to hire than people are being accommodated and brought into it. So it's, for me, because we work both sides of the coin, it's wonderful on one hand, and it's literally heart-wrenching on the other to make sure that we get the technology in the hands of the people who need it, and then all the platforms have to be accessible.
And we don't actually know how long we're going to have to work remotely. There's no end in sight, really. So do you have any best practices that you can give us that you think have that your organization has developed as a result of being in this pandemic, so that maybe other people can utilize those best practices going forward?
We at Sierra Group, we've made it a practice that everything we deliver face-to-face is also simulcast remotely. So we are literally, when going from face-to-face training to remote was hard. It took money, it took resources. We were all on a whole lot of adrenaline back then when the world shut down. But I immediately started thinking, what are we going to do when people start coming in small groups again? So we made the decision to simulcast everything. If we are face-to-face with a group, they're still looking at the computer, the headset is on, and everything we do is offered remote and face-to-face at the very same time, because I can't imagine pivoting back and forth more than once or twice. All of us have adapted pandemic safety officer duties and health and safety concerns. We've all taken on so much more without a lot more revenue. In some cases, with a drop off in revenue, we've just built everything to be deliver it once, remote and in person. That's my practice.
What a great practice. And same question for you, Bonnie. Can you add to this list that I'm creating here of best practices that institutions can use as we stay remote?
Yeah, I mean, my biggest suggestion is learned ourselves is know and utilize your resources. Everybody right now, in my experience, is more than willing to help because we're all in this together and we're all trying to figure it out. I work in the disability inclusion arena. Doesn't mean I know everything. So as we were transferring everything online, we worked very closely with our partner agency, that our Massachusetts Commission for the Blind, and said, what's better, Teams, Zoom? Like, do you have a JAWS reader, a JAWS user that could test this for us? Moving our career fair online, our conference online. Of course, we're always thinking about accessibility, but this really elevated it. And so tapping into them as the experts was awesome. And we built steering committees involving people we hadn't had before. So I would share that as a best practice with any of the organizations or higher education institutions that are, listening and watching and participating in the conference today, is reach out to your networks who are the experts in certain areas, because by nature of what they do, they're likely going to figure out that specialty area before you will.
Excellent advice. Reach out to networks. That couldn't have been said any better. What about you, Andrea? Are there things that you can add to our list of best practices?
Yes. I believe we need to just develop or have more education. Education, I think, is a very critical part. Many individuals are not aware of the abilities and the skills. So maybe we can just drive home more diversity training, diversity etiquette type of trainings.
Great. And Joe, our list is long. It's getting really long now. Bonnie gave us several. And
I'll keep it simple. Keep it simple. So some of the best practices that we've adopted is more communication and less communication at the same time. And this sounds weird, but here's how. So more communication in that there has to be more check-ins, right? Because in the past, we'd be able to walk to someone's office and say, hey, Bonnie, how you doing? I know there's a lot going on in the world, but how are you doing? So I've adopted where I have one-on-one check-ins with staff all the time, weekly, just to make sure they're doing okay. And I tell managers to do the same. They have to. And less communication, I've also put parameters around when we can have these Zoom meetings, right? So no meetings between 11 and 1, no meetings after noon on Fridays. We have to make sure that there's that work-life balance. And with work always being right in front of us, it's really hard because we want to do it all the time. And we have to take a break. There has to be a break, or this is how we get the Zoom fatigue and the Teams fatigue and the work fatigue, and then we get burnt out, right? So more communication and less communication.
Great. And Michelle, what can we do? How can we add to these best practices?
I mean, I think it's important that we listen to our stakeholders and the constituents that we serve. And so I think, we've done at the Commission is really not take anything personally when people said we should do this or we should do that, or this is working or this is not working. I think people really need to be open that how we're working through this, we don't know. And so we have to be very open about the things we don't know and not feel slighted when that is brought to our attention. And so I think what's really important for us and what we've been trying to do as we, started so long ago with the trainings that we were doing remotely, is just learn from the things that we maybe could have done better. And so for me, a best practice is to listen, because a lot of people like to talk, but a lot of people don't listen too. And so I think when we're providing services to people, we always have, one of the things that we do, which I think is really important, is we provide all sorts of access to us to tell us what you want us to hear. And so we have email addresses in our chat, we have telephone numbers in our chat, we have our web page in our chat, so that people can have clear access to us. We're not just kind of talking, we're listening. And so if you do that, I think it's really important for you to mold what your product's going to be as you move forward, because we're going to be in this for a while, even in the best of scenarios. This is not gonna, I was explaining to one of my colleagues this morning that back in April, I brought these really cute shoes for the summer. And I'm like, these shoes are super cute, and I'm gonna wear them this summer. And they have sat in the corner of my room staring at me, mocking me all summer. And I'm just thinking about when I'm going to wear my cute shoes again. I don't know. I hope they're very timeless though. So I'm feeling good that I can wear them at some point in the future, but we just don't know when this is going to end. And so I think we have to be thinking that it's going to go on longer. And that means we really have to shape the work that we do and the messages that we send to be as accessible to everybody, because it's not going to be a temporary, probably.
And we don't know when this is going to end. So how do we find the job seekers? What steps can you give institutions and employers step-by-step instructions as to how to find job seekers? Janet?
Well, one thing that we have to do when we're talking to employers is immediately remove the stigma that remote means people with disabilities can work more, or that it means they can work less, because people with disabilities have career goals and that are in line with their own skills and abilities. So many people are unaware that folks with disabilities, younger folks with neurodiverse disabilities, are out there as frontline workers, essential workers, grocery stores, drugstores, distribution, folks working at Amazon, making sure the economy is open, while at the same time, nurses with disabilities are also people with disabilities and they're working. Not every disability means that your immune system is compromised and you can't be in the public at work, nor does everybody with a disability, even if you're a power wheelchair user and it might be hard to get to work, that doesn't mean that you're an introvert and you'd rather stay at home. It can mean really almost no difference in what people's skills and abilities are. I come back to, it sounds like I've been on a soapbox, I come back to, we've got to make sure that we motivate a movement to eliminate the digital roadblock on the technology and make sure platforms are accessible so that nobody is left behind, and that technology, just like it's in the hands of school children now, it's got to be in the hands of people with disabilities that want to work.
Great, thank you. And Bonnie, can you jump in here?
Cheryl, can you repeat the question for me? Sorry. Oh, you're on mute.
Sure. We don't know when the pandemic is going to end. And how do we find job seekers? Because we're still remote. How do we find the job seekers and then give businesses the step-by-step instructions as to how to find job seekers?
Okay, so now I'm remembering now why I forgot that question, because it's loaded, right? I mean, that's the question we get all the time. Where are the candidates? Give me the job seekers. There's a lot of work, and Andrea talked about this earlier. There's a lot of work that's got to be done, and now is a great time to do it for organizations and making sure that you're disability inclusive. Is your website accessible? Are your job descriptions accessible? And are they inclusive? So can you read them and can you access them, but are they saying really what you want them to say? Your marketing, your branding, do the training internally. So all of those things can be going on right now. To answer the question about where do I find the candidates, all of us here, connect in with your state agencies, connect in with your employment service providers. Their job on a day-to-day basis is to work directly with individuals with disabilities to help them successfully prepare for, seek, and secure employment. So connect in with your network would be a big suggestion. All of us have different ways in which we do that. Some of us may have a job board. Some of us are doing career fairs. We have a private LinkedIn group for our disability in Massachusetts employers and individuals with disabilities that come through us. So every organization's kind of got a different gig going as far as how to connect. But the biggest step would be create your partnerships and reach out to your local organizations.
Great, thank you so much to you all. We have about a minute left, and I'm going to ask this question of Joe. What can the member institutions do to ensure compliance during this remote working situation?
Yeah, it's a good question, Cheryl. I think to ensure compliance, they just have to make sure they're communicating and they're making sure their processes are standardized. I think that's important, right? Now more than ever, that with people being remote, it's hard to keep track, but we have to make sure that we follow our processes. We have to make sure we follow our policies, and those all have to be standardized, right? And once we go off, we do something a little different, or maybe we interview someone a little differently, or we do something, we change our policy or we change our procedure, that's when we get ourselves in trouble. So now more than ever, we have to make sure that we follow the processes we put in place that are standardized, and we continue to do so, and we ensure that everyone else does as well.
Thank you so much to each one of our panelists. This has been such an illustrious panel of individuals who are experts in this area, experts in their field, experts in disability rights, and the information that you have provided is invaluable. And I'm sure that those listening will take away a lot of information that will be useful to them. We're going to say our farewell at this time. And thank you so much.